firefighters and law enforcement personnel are likely to be the first EMRs to arrive at a scene because A. They are trained in all aspects of an emergency call. B. They are typically paid and are on call 24 hours a day. C. Most communities do not have EMTs or paramedics. D. Of their location or speed in responding to the call. Two, the EMR must possess the ability to A. Sustain a patient's life for several hours. B. Avoid improvisation whenever possible. C. Function at the same level as an EMT. D. Treat patients using limited equipment. Fire units are often a crucial part of the EMS system because they A. Always arrive at the scene before EMTs or paramedics. B. Are better trained than EMTs to assist paramedics. C. Provide specialized rescue such as patient extrication. D. Provide protection and control of the scene. Which of the following most accurately describes an emergency medical responder? A. An individual who provides initial advanced life support. B. An individual who responds to the scene in an ambulance. C. The first medically trained person to arrive at the scene. D. A firefighter or police officer who assists the paramedics. A cardiac arrest patient's most crucial contact with the EMS system occurs when A. Trained EMRs arrive at the patient's side. B. Medical control is made aware of the situation. C. Paramedics arrive and administer advanced care. D. The receiving hospital is made aware of the situation. To provide the best possible care for the patient. A. All EMS personnel must function effectively as a team. B. The medical director must be notified during every emergency. C. A paramedic must be present at each and every emergency. D. The patient must receive rapid transport to the closest hospital. Components of the quality improvement process, as identified by the Institute of Medicine, include all of the following, except A. Safety. B. Timeliness. C. Efficiency. D. Teamwork. Which of the following statements regarding patient transport to the hospital is correct? A. Patients may require immediate stabilization at the closest hospital and then transfer to another facility. B. Any sick or injured patient should be transported to the closest hospital, regardless of the patient's condition. C. EMRs are legally obligated to accompany the patient in the back of the ambulance to the hospital. D. In most states and EMS systems, EMRs are not authorized to assist the EMT in the back of the ambulance. Skills commonly performed by the EMR include all of the following, except A. Intravenous therapy. B. Splinting fractures. C. Hemorrhage control. D. Treating shock. When EMTs or paramedics arrive at the scene of an emergency, the EMR should A. Accompany the patient to the receiving medical facility. B. Assume that his or her assistance will no longer be required. C. Assist the EMTs in continuing the care that he or she initiated. D. Obtain a signature from the EMT who is assuming patient care. Which of the following statements regarding stress is correct? A. Past experiences may make it difficult to deal with stress. B. Mass casualty incidents typically produce low stress levels. C. Most emergency calls produce only a minor level of stress. D. Very young patients tend to cause the least amount of stress. When you encounter a patient with a significant illness, it is important to remember that he or she A. May be experiencing any stage of grief. B. Is usually depressed and will not talk. C. Will always project anger toward you. D. Has probably already accepted the situation. Which of the following is not part of the standard precautions recommended by the Centers for Disease Control and Prevention, CDC? A. Use leather gloves as a barrier against blood and fluids. B. Wear a face shield if blood splatter is anticipated. C. Place needles directly in a puncture-proof container. D. Wash your hands immediately after patient contact. In which of the following situations would the use of a gown or apron, face shield, and gloves clearly be indicated? A. Emergency childbirth. B. Minor trauma. C. Obtaining vital signs. D. All emergency situations. To see his grandson graduate from high school, a man with a terminal illness promises to keep all of his doctor's appointments and take all of his medications exactly as prescribed. This is an example of A. Bargaining. B. Acceptance. C. Denial. D. Anger. A critical incident stress debriefing, CISD, is used to A. Alleviate the stress reactions caused by high-stress incidents. B. Determine whether any errors in patient care occurred. C. Investigate potential wrongdoings by the EMS responder. D. Identify the exact stressors that resulted in the stress reaction. Which of the following would most likely produce the greatest amount of stress for the EMR? A. Death. B. Anger. C. Exercise. D. Depression. Which of the following infectious diseases would be the least likely to be spread by the airborne droplet route? A. Methicillin-resistant Staphylococcus aureus, MRSA. B. Influenza. C. Tuberculosis, TB. D. Severe acute respiratory syndrome, SARS. The most effective way to prevent exposure to infectious diseases is to A. Follow standard precautions on all calls. B. Place a mask on all patients you treat. C. Ensure that your immunizations are current. D. Wash your hands thoroughly after each call. Ways in which the EMR can prevent and reduce unnecessary stress include all of the following, except A. Frequent exposure to stress-causing situations to train the mind. B. Being aware of the resources and services that are available. C. Adjustments in lifestyle to include stress-reducing activities. D. Learning to recognize the signs and symptoms of stress. Which of the following statements regarding the acceptance stage of the grieving process is correct? A. The patient understands that the situation cannot be changed. B. The patient is satisfied with the situation during this phase. C. Acceptance is typically the first stage of the grieving process. D. It is often characterized by sadness, despair, and denial. All of the following are part of the normal grieving process, except A. Violence. B. Anger. C. Depression. D. Acceptance. An elderly woman must be moved from an unsafe environment quickly. The patient is unconscious and is wearing a thin nightgown. What is the most rapid and effective way for you and your partner to move her? A. Grasp the patient by the collar of her nightgown and pull her in the direction of the long axis of her body. B. Place a blanket or rug on the ground, roll her onto it, and quickly remove her from the unsafe environment. C. Quickly log roll her onto a backboard, secure her to the board with straps, and move her to safety. D. Place her in a chair and rapidly move her to a place of safety while protecting her head and neck. Which of the following concepts is the first and most important when providing patient care? A. Render proper treatment. B. Above all else, do no harm. C. Provide your care in good faith. D. Maintain your composure. The recovery position is used for patients who are A. Unconscious and not injured. B. Semi-conscious with a neck injury. C. Severely obese and not breathing. D. Experiencing respiratory distress. With regard to lifting and moving, good body mechanics include: A. Twisting your body slightly when lifting. B. Using your legs and not your back when lifting. C. Lifting with the strong musculature of your back. D. Keeping your feet no less than 3 inch, 1 m apart. You are the first medically trained person to arrive at the scene of an ill person. You find the patient, a 350-pound man, sitting in a small bathroom. The patient tells you that he is extremely weak and is unable to walk. You should: A. Use the one-person walking assist technique to move the patient. B. Apply a cervical collar and position the patient on his left side. C. Wait for additional rescuers to arrive before trying to move him. D. Carefully lift the patient and move him to a more open area. The blanket drag would be most appropriate to use to move a patient if he or she is: A. Wearing clothing that is easily torn. B. In cardiac arrest and requires CPR. C. Underweight and semi-conscious. D. Wearing a sturdy shirt but no pants. In addition to ensuring your own safety, the most important guideline to follow when moving a patient is to: A. Do no further harm to the patient. B. Move the patient only when necessary. C. Move the patient as little as possible. D. Move the patient's body as a unit. Basic patient movement techniques require slight modification when moving a patient from a wrecked vehicle because the patient: A. Is not in a lying position. B. Cannot be grasped under the arms. C. Is often unconscious. D. Is usually trapped in the wreckage. The direct ground lift should not be performed if the patient: A. Is unconscious and not breathing. B. Has experienced a traumatic injury. C. Weighs more than 175 pounds, 79 kilograms. D. Has a back injury and is able to walk. Before attempting to move any patient, you should: A. Put on a protective back brace to facilitate the curvature of your back. B. Roll the patient onto his or her side to estimate his or her weight. C. Concentrate on what you are doing instead of the other rescuers. D. Assess the patient's weight and know your physical limitations. You are the first responder to arrive at an emergency scene. What should you do first? A. Survey the scene for potential safety hazards. B. Access the patient and initiate the appropriate care. C. Wait in your vehicle until law enforcement arrives. D. Determine exactly how many patients are involved. Regardless of the technique you use for moving patients, you should: A. Lift and lower the patient by bending your legs. B. Maintain a slight curvature of your back. C. Lift and lower the patient by bending your back. D. Keep your arms away from your body. Upon arriving at the scene of a major motor vehicle crash, you determine that there are multiple patients. You should A. Page additional help by using the mobile data terminal in your response vehicle. B. Immediately request additional resources using the mobile radio in your response vehicle. C. Call for additional help using a cellular phone after you have determined the severity of the patient's injuries. D. Triage all patients and then use your portable radio to call for additional resources. You arrive at the scene of an incident involving a motor vehicle and a pedestrian. Law enforcement officers are present, but the paramedic unit will not arrive for another 5 minutes. Your patient, who was struck by the vehicle, is a 16-year-old girl. She is unconscious and has severe bleeding from her head. You should A. Begin immediate treatment and ask a law enforcement officer to attempt to contact the child's parents. B. Keep curious bystanders away from the patient until the paramedic unit arrives at the scene. C. Contact the child's parents and obtain phone consent before rendering any emergency medical care. D. Ask a law enforcement officer to sign a statement that you are providing care without parental consent. Which of the following statements regarding a patient's consent to treatment is correct? A. A patient must be transported if he or she consents to treatment. B. Patients may refuse treatment at any time, even if treatment has begun. C. Patients can give consent to treatment only to an EMT or paramedic. D. Once a patient gives you consent, he or she cannot revoke it. When EMTs or paramedics arrive at an emergency scene, the EMR should A. Disengage from patient care and give them room to work. B. Apprise family members who may be present at the scene. C. Notify the dispatcher of their arrival and then depart the scene. D. Provide them with a handoff report and assist as needed. Which of the following is an example of an internal distraction that may hinder an EMR's communication with a patient? A. A loud bulldozer that is operating in a lot near a patient's residence. B. An angry husband who is demanding that the EMR care for his wife. C. Numerous family members who are giving the EMR patient information. D. Worrying about personal finances while at the scene of a car crash. EMR practice test. Emergency medical responders are crucial as they are often the first to provide immediate medical care. To become an EMR, one must pass a test that evaluates the essential knowledge and skills for handling medical emergencies. Importance of EMR certification. EMR certification is essential for proving that an individual meets the training and competency standards required for emergency medical response. It ensures responders are equipped with the necessary skills and knowledge to handle various medical emergencies.